37 of the House of Commons Standing Committee on Health. Today we meet for 2 hours with ministers and witnesses on our study of Bill C-31, an act respecting the cost of living relief measures related to dental care and rental housing. Today's meeting is taking place in a hybrid format pursuant to the House Order of June 23, 2022. All the regular opening remarks apply, including the warning against taking screenshots or photos of your screen. The proceedings will be made available on the House of Commons website. I would now like to welcome the ministers and witnesses with us here this afternoon. We have the Honourable Jean-Yves Duclos, Minister of Health, the Honourable Ahmed Hussein, Minister of Housing and Diversity and Inclusion. They are joined by officials from Health Canada, Dr. Stephen Lucas, Deputy Minister, Lynn Thompson, Associate Assistant Deputy Minister, Strategic Policy Branch. And we also have officials from the Canada Mortgage and Housing Corporation, Ms. Nadine LeBlanc, Senior Vice President Policy, Ms. Patricia Rosette Zupa, Vice President Policy Development. Thank you all for being here today. And just before we go to you, Minister Duclos, I believe we have a point of order from Monsieur Garon.
J'aimerais juste avoir confirmation de votre...
I'd like to have a confirmation that everyone on virtual have passed the sound verification tests. The clerk is confirming that they have conducted the adequate audio testing.
Thank you to all of the witnesses. Minister Duclos, we're going to start with you. You have the floor for the next 5 minutes. Welcome to the committee, Minister.
Merci beaucoup, Monsieur le Président. Et...
Thank you very much, Chairman, and thank you, all the members of the committee. This opportunity to discuss Bill C-31, an act respecting cost of living relief measures related to dental care and rental housing. And I am accompanied by Stephen Lucas, Deputy Minister of the Ministry of Health, and Lynn Thompson. Sound has disappeared. Can you hear me in the English translation on the... Have you understood what I've said? Yes? All right. Thank you. Also accompanied by Lynn Thompson, Associate Assistant Deputy Minister. Canadians, as you all know, have felt the influence of inflation. Food, housing, and other essentials are all becoming more and more expensive. So many families have to make difficult choices about how to spend their money, and unfortunately, certain expenses have to be put on hold, including dental care for kids. While inflation is a global challenge, the Government of Canada is continuing to take action to make life more affordable for families in this country. That's why we've tabled legislation that proposes a Canada Dental Benefit to help bridge the gap for families who struggle to pay for dental care for their children. If passed, this interim benefit will be available later this year to eligible families with children under the age of 12.
All agree that dental care is essential to maintaining good oral health. But for too many families, the cost of care makes seeing a dental professional simply out of reach. Approximately 1/3 of Canadians do not have insurance to cover dental costs. In 2018, more than 1 in 5 Canadians reported that they could not afford dental care. That is roughly 7 million people, many of whom are children. Faced with such difficult financial choices, too many parents have to postpone or forego important dental care for their children at a time where their teeth are developing. The result can mean poor oral health outcomes for some of our youngest children who could carry the consequences through their childhood and beyond. Monsieur le Président,
Mr. Chair, this is why we are introducing the Canada Dental Benefit. And under the proposed legislation, the benefit would be available for eligible families who satisfy the necessary eligibility criteria for children under 12. It would allow to have payments totaling $1,300 per eligible child over a 2-year period, up to $650 a year for dental care services. Furthermore, the benefit is tax-free. To be eligible for the benefit, applicants must, first, have a child under 12 years of age in their care who does not have access to private dental care. Secondly, they may be asked to provide information from their employer to verify whether or not they have access to dental insurance. Third, have an adjusted family net income under $90,000 per year. Next, have filed a most recent income tax return. Be the parent or legal guardian who receives the Canada Child Care Benefit, and have spent or plan to spend money on dental care expenses for that child who would not be fully reimbursed under another public program. Parents would be able to apply for benefits through Revenue Canada's agency My Account or their CRA contact center. If eligible, the parents would receive a payment up front that they can use to take their child to the dentist or another dental specialist. This way, the family would not be out of pocket for dental expenses that they can't afford. And this will help to ensure that children do not miss out on important dental care at a critical point in their development.
in Canada, we do believe that cost should not be a barrier to proper health care, including oral health care. If passed, the Canada Dental Benefit would provide more equitable access to dental care for children so that they can enjoy the benefits of positive oral health. Our hope is that the proposed legislation will be passed quickly so that eligible families can receive the Canada Dental Benefit in 2022. Thank you. Merci.
Thank you, Minister Duclos. Next, the Minister of Housing, Diversity and Inclusion, the Honourable Ahmed Hussein. Welcome to the committee, Minister Hussein. You have the floor for the next 5 minutes.
Merci, Monsieur le Président. Avant de commencer.
Thank you very much, Chair. Before beginning, I'd like to acknowledge that the land on which we are gathered today is the unceded traditional territories of the Algonquin Anishinaabe people.
Today to talk about one of the affordability measures that we introduced in the House of Commons on September the 20th, the one-time top-up to the Canada Housing Benefit. Our government has made housing a priority throughout its mandate, and we all believe that every Canadian deserves a safe and affordable place to call home. But we also recognize that it is becoming increasingly challenging for many Canadians to afford rent or to find housing across the country. As part of our efforts to make life more affordable for Canadians in all aspects of their life, our government recognizes that many need immediate additional assistance. That's why we introduced this legislation to provide a direct federal Canada Housing Benefit top-up payment of $500 to 1.8 million Canadians who are struggling with the cost of rent. The impacts of the pandemic are still being felt by many Canadians. This one-time top-up will be a tax-free payment to provide direct support to low-income renters, those most exposed to who are experiencing housing affordability challenges. This federal benefit will be available to applicants with an adjusted net income below $35,000 for families or below $20,000 for individuals, and who pay at least 30% of their adjusted net income on rent. Ce n'est pas pour rien que le logement.
There's a reason why housing is at the heart of Budget 2022, with more than $14 billion having been committed to doubling the number of new, safe, and affordable homes, which we'll be building across the country in order to tackle the rising cost of housing and find long-term solutions for the housing sector in Canada.
payment will be in addition to the already existing Canada Housing Benefit that is already delivered together in partnership with provinces and territories. And families, we know, need this support now. That is why we're hoping that this payment will be launched before the end of the year. This one-time payment for renters is another targeted approach to ensuring vulnerable families are not left behind, and it is part of our government's plan to make housing more affordable for all Canadians. Toutefois, il ne suffit pas de trouver un.
However, it's not enough to find a single solution to help Canadians who need help most. The National Housing Strategy, which will be costing planned $72 billion over 10 years, includes multiple solutions to make more housing affordable for more people.
That has already delivered or is on track to deliver over 10,250 permanently affordable homes for the most vulnerable. And as announced in Budget 2022, the success of this program is leading us to move forward with the third round of the Rapid Housing Initiative, which will deliver an additional 4,500 units of deeply affordable housing for the most vulnerable. So I want to close by reiterating that making life more affordable for Canadians who need it most is a top priority for our government. Our proposed one-time top-up payment to the Canada Housing Benefit will help us deliver on this priority and offer real help to Canadians who need it now. These are the kinds of measures that our government is putting into action right now to tackle the housing crisis while taking a human rights-based approach to housing. I want to thank you, Mr. Chair, for this opportunity, and I'm happy to answer any questions posed by my colleagues. Merci beaucoup.
Thank you, Minister. We're now going to proceed with rounds of questions, beginning with the Conservatives. Ms. Goodridge, please, for 6 minutes.
Thank you, Mr. Chair, and thank you to the ministers for attending. It would have been nice to have been able to have more witnesses, but alas, here we are. So I will start out to the Minister of Health. Did you consult with the Minister of Health from Newfoundland?
Thank you for the question. And yes, we have talked and listened to and engaged with all health ministers. We have had many meetings over the last few months, and although we're working on different files, we all know that this file is important.
All right. So you consulted with every single Minister of Health specifically on this piece of legislation before introducing it?
As I said, we've spoken and we listened to all health ministers. We've had many meetings in the last few months, and we are working on many different important files, Canadian to Canadians, and this one is also an important one.
Did all the health ministers support this?
All health ministers, and I'm one of them, recognize that dental care is health care. And when you invest in dental care, you invest in prevention, you invest in diagnostic, and you invest in treatments. If a child ends up in a hospital and with generalized infection
Minister, we have a convention in this committee where you can answer for about as long as the question takes. So I will shift gears now to Minister Hussein. Wondering to yourself, did you consult with the provincial and territorial ministers of housing?
Absolutely. Not only am I in constant contact with my counterparts, ministers in the provinces and territories, we recently concluded very productive federal, provincial, territorial ministers responsible for housing and homelessness, but we've engaged constantly on issues around supports for renters.
So they were supportive of this exact legislation?
Well, I spoke to them about the need to support Canadian renters, low-income families.
Support this exact legislation, yes or no?
We remain in touch on all aspects of the housing spectrum, including how to better support vulnerable renters. And
so,
this
Minister,
is one of the approaches to do that.
With all due respect, most rent across the country is on average $2,000 a month. This will cover approximately 1 week's rent in the entire year. I'm not sure if this is going to solve the homelessness issue across this country.
My response to that is that this is a one-time top-up payment to an already existing program called the Canada Housing Benefit, which already delivers an average of $2,500 to Canadian renters from coast to coast to coast. And I want to also just highlight the fact that all 10 provinces and 3 territories have signed on to the Canada Housing Benefit. It's a cost-shared program, but this particular payment will reach 1.8 million Canadian renters, and we know that they need that support now.
Minister, how many affordable housing units were built in the territory of Nunavut in this last year?
I can tell you that we have a number of programs in the north to tackle the specific challenges.
How many housing units?
I'm happy to answer the question if you let me. In the north, we understand the unique challenges faced by northern communities when it comes to building affordable housing. We've dedicated not only
Minister, it was a simple question. A simple answer would be appreciated.
I'm happy to answer if you let me. So if I may continue, we understand the importance of investing in affordable housing in the north. Over the years, we've put in place programs that enable northern communities to access more federal housing dollars.
Go ahead, Dr. Ellis.
Thank you, Chair, for recognizing this. I think this exact issue we went through, and sadly, the Conservatives were on the losing end of this last time, Mr. Chair. I would respectfully ask that the give and take that we've established, which I think has worked very well in this committee, be respected here. I think my colleague has asked multiple times that the minister ask a very short answer question, which to me would be a number. It's either somewhere between 0 and 8 gazillion, and I don't think that we need an explanation. It's a number. Thank you, sir.
Ms. Goodridge has ensured that Minister Hussein has not gone on longer than the period of her question. Which she is absolutely entitled to do. So I'm not sure that we've breached the convention. If she's not satisfied with the answer, that's not something that the chair can fix. But in terms of being fair to the witness and fair to the person posing the questions, I think we're doing fine. Go ahead, Ms. Goodrich.
Thank you. I was just simply trying to get a simple number that I would have hoped that the minister would have readily at his disposal of every housing unit that's been created across this country. And clearly the answer is that he does not have that simple fact. There are 3 territories that have unique housing needs, and the minister was completely unable to provide a simple answer as to how many housing units were built in this last year. And the lack of affordable housing units directly impacts homelessness and housing crisis in northern communities, and it's something that's very near and dear to my heart. And it's disappointing that a simple question that was asked multiple times did not receive a simple answer. But I will digress. I don't think I'm going to get an answer to this. So I will switch back to the Minister of Health. What would prevent a low-income family with private insurance from utilizing this plan?
What would prevent that family from? Well, the rules are quite clear. You need to have a child below the age of 12. You need to have you need not to have access to private dental insurance, and you need to incur expenditures on dental care.
Okay, but how would you know if someone had private insurance or not?
Well,
is it just based on the honor system?
It's based on attestation that people need to fill in, and then it will be based by monitoring and possible enforcement by CRA, the Canada Revenue Agency.
Have you guys done a costing of what the administration would cost for the enforcement side?
Well, I understand, and we understand you'll be having access to great officials with great advice and information on the role of the CRA later this afternoon or this evening, and I suppose and suggest you talk to them.
So the answer is not that you're aware of?
Well, it's a matter of officials who know the file and provide the right information and the correct answer to a great question.
We actually asked to have the Minister of CRA present, and that was declined.
Thank you, Ms. Goodrich. Next, Ms. Sidhu, please, for 6 minutes.
Thank you, Chair. Thank you, Minister Hussein, Minister Duclos, and all of the officials for joining us to help advance this important piece of legislation. My first question is to Minister Duclos. Minister, I know we have said that this is the first step. Can you comment on how Bill C-31 will help inform the full vision for dental coverage for all Canadians?
Well, thank you, MP Sidhu. Thank you, Sonia. We know that approximately 7 million Canadians don't go to see a dentist every year because dental care is too expensive. Now, that's a terrible outcome because not doing so means that they end up with lack of preventive care, lack of diagnostic, lack of treatment, and in many cases they end up in an emergency room. About $2 billion in hospitalization costs are spent every year to look after emergency dental care, most of which would not be needed if those people had had access to proper dental care in this country.
I know December 1st is coming. This is a target date for children under 12 to benefit from better dental care. Can you speak about how it will roll out once this bill receives royal assent?
If Parliament approves the bill, as you said, MP Sidhu Sonia, by December 1st, we are hoping to make Canadians access this benefit. Approximately 500,000 children below the age of 12 would be eligible to that benefit. It would save, obviously, a lot of money in the context in which the cost of living is very severe for families with children, especially young children. And in addition to that, as we noted, that would help those children not only avoid the severe mental and health and physical health cost of not having access to dental care, but then it would reduce the risk of future diabetes, cardiovascular disease, gastrointestinal disease, including the risk of generalized infection, which the cost of which, when people go to a hospital, can range between $12,000 and $25,000 per emergency visit.
Thank you. My next question is to Minister Husain. Minister Husain, you said in your remarks 1.8 million renters will get benefit on the one-time top-up. Can you explain that, how they can apply and how they will getting this top-up benefit? And how many? It's 1.8 million renters.
Thank you very much, MP Sidhu, for that important question. Yes, this legislation will benefit 1.8 million renters struggling with the cost of housing in this country. It will be available to applicants with family income of below $35,000 or $20,000 for individuals who pay at least 30% of their net income on rent. The application process for this benefit will be attestation-based, as my colleague has indicated, and the CRA will provide the upfront verification of an applicant's eligibility. It's really important to also note that this benefit will not reduce other federal income-based benefits programs, and we will work with provinces and territories to ensure that recipients do not have their provincial or territorial benefits negatively impacted as a result of receiving this housing benefit. The payment will be launched by the end of the year, pending passage of this legislation. And so I really urge my Conservative colleagues to stop obstructing the passage of this legislation and help us to deliver this much-needed payment to Canadians as soon as possible.
Mr. Hussain, I'm coming back to Minister Duclos. Minister Duclos, you mentioned that 2 million school days are missed by children every year because they need to go to the emergency dental care. Can you expand on how this bill will help avoid emergency dental care interventions?
That's correct. About 2.2 million days of schools are missed by children because of emergency dental care, as you noted. Now, they unfortunately, in many cases, end up in an emergency room in a hospital where we know this is not the right place for children to be looked after. That is also the source of the majority of surgeries under anesthesia for children. So if you look at all surgeries under anesthesia that are done for children, the majority of those are due to dental conditions, which again, prevention would have prevented in many cases. And it obviously impacts more and much more so for the lower income families, including families from marginalized communities who face all sorts of trouble and struggles in life, making them again very unable to access basic fundamental dental care for their children. So it's a fundamental right in Canada to have access to appropriate health care, and that includes appropriate dental care.
I just want to say thank you, ministers and all officials. Thank you for your hard work. And it's important legislation. I know how many millions of Canadians are getting benefit from it. Thank you.
Thank you, Ms. Sidou. Monsieur Garon pour 6 minutes.
Merci, monsieur.
Thank you, Chair, and thank you, ministers, and also for the staff following them. The PBO has demonstrated recently that your dental program is going to penalize Quebec. 23% of the children are in Quebec, and they'll receive 13% of the benefit. This penalty on Quebec occurs for two reasons. They have their own coverage of dental care for under 10 of age, and there's a higher unionization rate, so they have access to group insurance. I'm very anxious to have Quebecois hear your answer. I understand that your government, supported by the NDP, is anti-union. Well, thank you very much, Mr. Garon, for this question. I'm glad that you're interested in the file on behalf of Quebec children, Quebec population. This encompasses the Quebec program. It covers age 10 and under, if you will, or 9 and under. But dental care is important for all grade. Whether it's a cleaning, you haven't answered the question. This bill is anti-union. Were you aware of that? This bill is anti-union? Well, you're insisting on that. It's an appropriate question nonetheless, given how you are interested in this question. These children, Quebec children, will have a coverage which is reinforced, particularly for preventative dental interventions. It's essential to have preventative measures. And to avoid further medical problems, prevention is best. Well, he doesn't realize that it's an anti-union bill, so we'll remind Quebecers of that. This procedure, sending checks using government spending power to individuals, had we done the same thing in the 70s on health issues to the provinces, rather than helping the provinces build the public sector health services, we'd have private medical care. As you know full well, this is a first step to improving the program of dental services, dental regime. We will be moving up onto a pan-Canadian dental care. So you're in a good mood today, but you don't mind coming to the committee today that a Quebecois is only only merits half of what is being obtained by the others in Canada. Well, I answered you earlier, and you interrupted me. Children under the age of 10 benefit from a program currently. This insurance will be complementary, supplementary to this, offered to all Quebec families with children under the age of 12 for essential dental services. As you know, in terms of health, it's much more important to prevent than cure. Well, it's not an excellent bill, but you've really hammered on that. We heard that it was pointless to call witnesses today because the whole thing was cooked up in advance and we weren't going to get any answers here. Are you good with that? Well, if you invited me more often, I'd be quite pleased to participate in the works of your committees and your discussions. The issues that you deal with, the minister does not have direct impact.
Monsieur Garon has asked, or he's actually implied that we said something in camera. We're not allowed to talk about what we've talked about in camera.
I actually wondered whether his reference was to something that was said in camera or something that may otherwise have been said in the House, and I don't know that. Mais Monsieur Garand, si le sujet dont vous
Monsieur Garon, if it was mentioned in camera, would you like to specify that? Mr. Minister of Health, you could have increased the benefits to children equitably so that there's no connection between how much the costs of a dentist are and this amount. Well, this is a dental benefit. Families will use this to cover dental costs which they otherwise would not have covered or been able to pay for. Thank you, Chair. Thank you, Chair. We're very short on time here. For the Ministry of Health, you are to work with the provinces to develop a coordinated plan for the building. Who is the Minister of Housing in Quebec? Do you have her name? So you haven't called her then if you don't remember her name. We've met once in our life, and I know your name.
Monsieur le ministre, c'est correct, on a la réponse.
Okay, we have an answer. It's clear enough. You're also Minister for Equity. And currently, under your program, an elderly person who lives in Quebec, poor, living alone, only with the CPP, has $20,500 a year and would be ineligible to this benefit. Is that how you read it?
The new minister's France, Hélène Doranceau.
Non, ça c'était la question d'avant. Là, il y a une nouvelle question.
Well, you asked me the question I'm answering. In terms of the issue about the money helping residents of Quebec, nous savons qu'il est de plus en plus.
We know that it's more and more difficult for Canadians to pay their rent and even to find an affordable unit to rent. So this is why we're introducing legislation in which will allow us to very quickly offer them $500 to 1.8 million Canadians who are having difficulty paying the rent.
Residents of Quebec, this will help them as well. This already builds up on the existing Canada Housing Benefit Agreement that we've signed with the province of Quebec. That's already helping 145,000 households in Quebec. So we've been active on providing rental supports to vulnerable Quebecers, and we'll continue to do that with this one-time top-up.
Thank you, Minister. Merci, Monsieur Garand. Next, Ms. Kwan for 6 minutes. Welcome to the committee, Ms. Kwan. You have the floor.
Okay. Well, thank you very much, Mr. Chair, and thank you, ministers and your officials to be here today. First, I'd like to ask a question of Minister Duclos with respect to the dental care plan. One of the issues that surface, and I know that constituents of mine and others have been asking, and I want to hear directly from the minister about this. For Indigenous children, they are under a different program, the non-insured health benefits program. Does the provisions within this initiative, how does it measure against that? And that is to say, is it the case that Indigenous children under the non-insured health benefits are getting equivalent services or supports under their program?
Thank you, MP Kwan. So it's a great question. Let me try to answer it in two pieces. First, you're correct. Now, the non-insured health benefits are available for Indigenous children. Second, this benefit could be also available to them if, although it's unlikely, if there are services that they would need in addition to NIHB which they would need to pay for themselves, and then they could ask for the benefit to cover those extra costs. But otherwise, these two benefits are quite different, because this is an interim benefit which requires people to ask for support before they see a dentist, whereas NIHP is a dental insurance plan which doesn't require people to ask for support first before they go and see a dental professional.
Is it your anticipation, Minister, then, that once this program is fully in force, that those under the NIHP coverage would get equivalent coverage if under the NIHP initiative they're not getting the same level of coverage? Is that your anticipation then, Minister?
I would say that the top priority is to make sure that Indigenous children in Canada have the dental care they need and they deserve. That's the utmost priority, and then we will work in a manner which makes sure that this remains the case. And we look forward to working with all members of this House and some more in particular to make sure that the other longer-term program is as susceptible as possible to assist the dental health conditions of non-Indigenous Canadians.
Thank you. Just to follow up on the dental care piece, and now I'm going to turn to housing. There's the income threshold that's required, less than 70,000 or less than 90,000, and it's based on the previous year's income assessment. If during the course of the year, especially now with the economy being potentially being impacted with a recession, people might lose their job. In the event that should happen, people might lose their insurance midway through. Is there an ability for them to access the dental care?
The dental care eligibility is based on eligibility to the CCB, the Canada Child Benefit. Now, we don't have officials around this table, although Ms. Thompson would probably know more than I do. There are no officials from CRA and ESDC would be able to detail how CCB is or is not adjusted according to changes in yearly income in the conditions that you described. Ms. Thompson?
So yes, I know there is adjustments. I just don't know the regularity of which it is done under the child benefit. We can get that for you at later on this evening.
Okay, that would be great. I assume that there would be adjustments as long as there's flexibility in the program to accommodate that, because people's circumstances may well change. And so it sounds like that there is a process with respect to that, and I'll wait for the detailed information later on tonight. I'd like to turn to then on the housing piece to Minister Hussen. One of the issues that comes up from time to time is that when the federal government, for example, provided for pandemic support to people in need, it impacted people's situation in their, let's say, GIS eligibility. And so I just want to make sure with this $500 one-time benefit that it would not impact people's eligibility, one, for GIS, and second, for those who might be living in a partially subsidized situation, because their partially subsidized situation is based on their income. And when they receive this $500 injection, it would change their income, right? Increase by $500. And then as a result, their landlord, the manager of those buildings, may well increase their rent for the following year. I wonder whether or not the minister has given that some thought and ensure that measures are in place to ensure that people's GIS is not going to be impacted. And second, those who are in those kinds of housing situations are not going to see their rent increase as a result of this one-time increase in benefit.
Thank you very much for the question, Madam Kwan. And I can tell you that this benefit will not impact federal income-based benefits, and we will work very diligently with provinces and territories to also ensure that recipients do not have their provincial or territorial benefits negatively impacted as a result of this payment. With respect to the scenario you highlighted with respect to landlords, we would my aim would be to make sure that as we provide this rental supports to vulnerable renters, that it doesn't actually lead to an increase in their rent, and we will work to ensure that that's not the case. We're still looking at those different scenarios, but the one that you highlighted is very important, and we need to pay particular attention to that.
Thank you, Minister. Thank you, Ms. Kwan. Next, Mr. Doherty, please, for 5 minutes.
Thank you, Mr. Chair. Mr. Duclos, Minister Duclos, a question for you. I just want, and perhaps Minister Hussein as well too. I came late. I want to make sure that I'm hearing this correctly. With the CERB, we have, and I'm sure many of my colleagues are dealing with the same as what I'm seeing in my riding, is that we have seniors and we have those that applied for CERB, received CERB, and then after the fact, we're told that they indeed were ineligible, and now their OAS and GIS are being clawed back. Is this going to impact that, and are we going to see similar to what we're seeing with CERB and experiencing that? We have seniors that are becoming very marginalized, and want assurances from you that this is not going to be the case. And what steps have been taken to ensure this?
Thank you for the great question. It's not going to impact CERB, obviously, because CERB is...
GIS and GIS and OAS.
So I thought you had obviously understood that. And B, it's not going to impact other benefits because this is considered to be a non-taxable benefit. So it has no impact on the CCB, GIS, or OAS.
Okay. And to Minister Hussein, again, I came in late. How many affordable housing units were built in none of it?
So the different national housing strategy programs that are working on the ground in Nunavut are varied, and they have different deliverables in terms of the unit numbers, the affordability levels, and the
Just
dollar
looking for a
amount.
number.
So I can get you a total number, but I can also tell you how much money we've invested in Nunavut and the different programs that have gone into.
Can you get it to the community by the end of the week, please?
I can certainly turn to my officials to work with you on that. Yes.
Mr. Duclos, under the proposed section of Dental Benefits Act, Section 7, eligible families can apply to receive additional benefits if a child's dental care exceeds $650. Is there a cap on the dollar amount of this additional benefit?
So the maximum is $650 per year, $1,300 over 2 years. Beyond this level of $70,000 family income, there is a co-payment. There is a co-payment, which is 40%. Another co-payment of 60% beyond $80,000 to $90,000. So before $70,000, no co-payment, so up to $650, and then the two levels of co-payment I mentioned between $70,000 and $90,000.
How many thresholds attained? How'd you come up with them?
Well, first, that was the commitment we made. And second, there needs to be a slight change between 70,000 and 90,000 for there not to be an abrupt cliff at 90,000. So it's one way. It's a way to smooth.
I don't think, Minister, with all due respect, you're not answering my question. How did you come up with these thresholds?
These are thresholds that have been suggested by various stakeholders who have all sorts of experience in...
Stakeholders?
Well, we've consulted. I have a big list of them, about 2 pages. I can list them. I suppose that's not of great interest to all of the committee members, but obviously experts, including dental health care experts, but also dental health experts from a variety of perspectives.
Now, with respect to both the rental and dental payments, how are those thresholds come to, the 500 and 650? How are they thought up? Like, why 650 per year for 2 years? And why 500 for Minister Hussein?
Okay.
On the $500 one-time top-up payment to the Canada Housing Benefit, I always have I feel like I have to always repeat this. This is on top of an existing permanent program called the Canada Housing Benefit, which is delivering an average of $2,500 to vulnerable renters right across the country in every province and territory. So the Canada Housing Benefit is working, but we recognize there's additional challenges, and that's why this one-time top-up
Thank
payment
you,
of $500 is very, very critical.
Mr. Duclos, with respect to the proposed Section 9.2, in the case of a shared custody of a parent that is entitled to 50% of the amount of benefit outlined in proposed Section 9.1, can you explain the rationale behind the decision to split the amount between parents in a shared custody situation?
That's a great question, and let me turn to Ms. Thompson, because a great question requires a good answer, and she'll provide a good answer.
It's because, well, this is based on the Child Canada Benefit, and that is how that is structured. So in shared custody, it is 50% shared by the agreement that that CRA would have in its possession about the arrangement with that child. So we are following that same approach as is being undertaken under that the Canada Child Benefit. So each parent would need to apply, and they could receive 50% depending on their income.
Ms. Thompson, Mr. Doherty. Next, Mr. Johari, please, for 5 minutes.
Thank you, Mr. Chair. And first of all, thank you to both ministers and your officials for coming on such short notice. And I understand this is a bill that's not important. It's important, not only important to the government, but important to Canadians. So I just wanted to acknowledge that and thank you. I'm going to start with Minister Duclos. Minister Duclos, at the outset, there was a lot of discussion around consultation with the provinces and territories. You were very clear on responding to that. Some of my colleagues later on asked about the level of consultation that were done with the expert, and you said you're in a position to be able to share that. So, sir, can you share with us who did you talk to and what was the scope of it, and probably shed some further light into that breakdown that was the topic of discussion a few minutes ago? Thank you, sir.
Thank you, and you'll stop me when I have exhausted my time. So the Canadian Dental Association, the Manitoba Dental Association, the Ontario Dental Association, New Brunswick, Yukon, Nova Scotia Dental Association of PEI, and then I'll skip a couple of others. The Canadian Dental Hygienists Association, l'Association des chirurgiens dentistes du Québec, l'Association des facultés de dentisterie du Canada, l'Association canadienne de dentisterie de la santé publique, l'Association canadienne des assistants dentaires, l'Association canadienne des thérapeutes dentaires, the Denturist Association of Canada, the Canadian Academy of Pediatric Dentistry, the Canadian Association of Emergency Physicians, the Coalition for Dental Care, the Canadian Society for Disability and Oral Health, the Society of Rural Physicians of Canada, Children's Healthcare Canada, HelpAge Canada, and I have about 20 more that I could list also.
Thank you, Minister. That really gave me a sense of not only you reached out to the oral healthcare professionals, but also to the pediatrics doctors to be able to kind of have a whole of an approach. And now it makes me a lot more comfortable understanding where the rates or the benefit around 650 came. Was there a logic into saying, hey, look, 650 is equivalent to one annual checkup, one annual, cleaning, and one annual? Is there anything that you or your official could shed light on that?
That's a wonderful question, and it's indeed what we did. When I say we, it's all of these experts and very engaged stakeholders that care very much about the dental health of our children. They looked at what, as you said, a basket of preventive, diagnostic, and curative services would be, looking at over a significant amount of time. So what's right for them to have as we said in French earlier, to have to reduce their risk of ending up in a bad oral health condition, which, as I said, can lead to severe cases of generalized infections and diabetes and many other diseases which have an impact on their long-term health conditions. So having constructed that basket, they estimated the average cost of that particular basket, and then they ended up with that figure, about $650, which in some cases might be above what they would need in a particular year, but that's fine because the cost of living for families with such young children is very significant, and we know they'll be using these resources for the better and the best health care services possible for their children.
Thank you, Minister. Minister, this package is called Canada Dental Benefit, and we understand it's over 2 years, but this is our initial work toward what we call the National Dental Care Program. Can you explain how the work that we are doing now would strongly position us in be able to not only develop but roll out the longer-term National Daycare Program? Dental Care Program.
Well, thank you, MP Johari, for recalling that this is a first step, an interim benefit, which is going to have an immediate impact on approximately 500,000 children of low to average incomes, and this is where we know the needs are the greatest. But then, as you also pointed to, there will be a second program, a longer-term program, which, as we discussed earlier with MP Kwan, will be better suited to the dental health care that other Canadians, but including the younger children, will need over time. That includes seniors, people with disabilities, people with relatively low or middle income ranges. So we know that this is going to be further improved over time, but we're quite proud and very grateful of your support, proud of this immediate step that we're going to soon be able to take, following, hopefully, approval by Parliament.
Thank you, Minister. Thank you, Mr. Johari. Monsieur Garand, pour 2 minutes et demie.
Monsieur le ministre de la Santé, on fait un petit sprint. Je vous pose une question technique.
I have a technical question. If I'm a sole parent and I would qualify, I submit a $250 bill. How much would it be? Well, nobody would, if you, it's a sprint, Mr. Chairman, $650 now. I'm sure that you're aware for a $2 bill from the dentist, you're going to offer $630 to a family, and that'll be excluded if you're in Quebec. And that $2, this benefit will never be available for another child who might need that money. You know how insurance works, of course. You're an economist. Well, benefits are given to families with low revenue. If a single parent family, a mother who's the sole breadwinner for her children, that individual would be unable to use that money to spend on her children. I think that's a bit of an exaggeration. Well, I think I still have to manage my time here, and if there was a possibility to give to Quebec an opting out option, but to be compensated for that, what would you choose? Immediate benefits, or a little maple leaf in the corner of the check? What are you looking for? Well, I would choose what you choose: the immediate benefit. Every time I try to answer something, you're something useful. I don't think that's the objective we have here at this meeting. The immediate need, the immediate services as required, that's what we want to deal with. And we all should be happy about that because it's supplementary. I am sorry, but I speak with economists, which you know or have met occasionally in your career. You're actually preventing, you're putting an obstacle in the way of any bill that might come in if it goes over a certain amount. Now, we had to be quick in order to satisfy the NDP. So what do you think of that? Well, yes, it's an obstacle, of course. There's a lot of families in Quebec who are looking at financial obstacles. It's not easy in Quebec as anywhere else. I don't know your personal situation, but I had kids. I had a fairly good salary as a university professor, such as you yourself were. People have much lower salaries, and they have difficulty paying the rent at the end of the month. And if they have to choose between the groceries, the rent, or send the kid to a dentist, this program will add to what the Quebec government is already supplying.
Thank you, Mr. Chair. Yeah, the NDP actually support this program. We feel very strongly that there should be a universal dental care program, and we're glad to hear that this is now before us. Now, because this is by attestation for both the dental piece as well as the housing benefit, one-time housing benefit top-up, what plans does the government have to ensure that people know so that they can apply?
That's very important, MP Kwan, and that's why these conversations are so valuable. Now, we still have a few more weeks, but A, we must pass this bill, given the urgency of the situation, and B, we must all work together so that once this bill is passed, Canadians know about it. So as MPs, this is one of our roles, to make Canadians, and especially Canadians with lower incomes, know about the program and access it, because this is good only if people do access it. So we have a lot of work to do in the next few weeks.
Same question for Mr. Hassan.
In addition to what Minister Duclos has just stated, I think it's also important to seek out all the different stakeholders that the Minister has stated, in addition to all the affordable housing stakeholders and advocates, to amplify what we're doing here so that vulnerable Canadians can benefit from this important help.
Would the government be undertaking, for example, in the dental care plan, because it's based on people's income, be able to actually send information directly to people's households to advise them that if your income is less than 90,000, less than 70,000, you would be eligible? Do a mail out like that to every household so that people would become aware. And you could do the same actually for the housing benefit as well. Would that be considered?
That's an excellent suggestion. And I would propose, and I certainly wouldn't want to impose that, but I would propose you ask the question to the CRA officials that have come, because there are other things that the CRA does in general, such as awareness of the Canada Child Benefit, awareness of the old age security, the guaranteed income supplement, and I would suppose that they've already thought through this important these important actions that they can take to raise awareness and therefore increase access.
Yeah, because this is all based on, or is tied to the child care benefit. So then you actually have that on the system on who is actually accessing that program. So if a mailer went out to the people, so then they would actually be able to have this information, I think that would be very useful. Now, on the application process, and this particularly in relation to the housing benefit, the application process is only a 90-day process, which is a very quick turnaround. And I'm particularly worried about people who have little access to technology or have language barriers, would not be able to know about the program and be able to access it. So what is the minister doing to address that?
Can you come to your question quickly? You're out of time.
Yep, that was my question.
A brief answer, please.
I think it's important to work with a number of different advocates and organizations that do a lot of work to help people navigate different benefit systems, people who are eligible and need these supports, and we'll work with them to make sure that that's the case, as well as working, as I said earlier, with provinces and territories to ensure that people are not negatively impacted.
Thank you. Dr. Ellis, please, for 5 minutes.
Thank you, Mr. Chair, and thank you to the witnesses. Minister Duclos, are you aware of how many witnesses are appearing before this committee that intends to spend $10 billion with this bill over 5 years?
Thank you, MP Ellis. I'm not aware of the committee's work. I think this is work done independently, certainly of ministers like myself, so I would ask the question.
Any idea how many public sector witnesses are going to be coming before this committee for spending $10 billion over 5 years?
I'm certainly aware of these two there.
Public sector, sir.
Sorry?
Public sector witnesses.
Well, these are in the public sector. These are in Health Canada.
They were with the government. Great, thank you, sir. That being said, think about this. An economist once said, people need to learn how to spend their money. Certain things need to be put on hold. Good words, I would suggest, sir. Do you agree with that?
I think, yes, resources are rare. They need to be allocated where they matter the most. And as I said earlier,
Great, thank you. No, that's wonderful, because it was you who said that. It's interesting, sir, that the mental health transfers in the platform of the Liberal election platform of 2021, $875 million was to be spent or budgeted by now on mental health care. And here we are, we've not seen any of that money, sir, and we're spending money on dental care. That was promised in your platform. Dental care was not. Reason for that?
in the platform, there were indeed $3 billion targeted for mental health care, plus additional dollars, and the $3 billion are in the fiscal framework, and we are negotiating agreements with provinces and territories on how to allocate them over the next 5 years.
Sir, we're beyond the year, $875 million, not budgeted, not a penny spent, and we're spending something that was not in your platform. Can you explain to me the urgency, I guess, sir, that we need to get this money out there? Sorry, just one thing I might add. I apologize for interrupting you. In fact, we do know there is a crisis in mental health care. I think everybody here knows that. I think anybody you passed on the street would say that. I'm not meaning to be disparaging on dental care, but I don't think anybody out there would say there's a dental care crisis. Mental health? Yes. True. Dental care crisis? I don't know about that, sir. $875 million. Would you agree that there's a mental health crisis in this country?
Yes, there is one.
Great,
and that's
thank you,
why
sir.
that's why we're
That.
acting. And that's why, as I said...
That's a little too abrupt after a 40-second question. Minister, go ahead. You've got another 38 seconds to answer the question.
And that's why, as I said earlier, we have a $3 billion that we are currently allocated to provinces and territories, in addition to the other $3 billion that we have invested in since 2017. Remember, the 2017 agreement was for over 10 years, 3 plus 3. We're currently in the second 5 years, and that's why those $3 billion are there. And there'll be more, because the Prime Minister promised that, and he promised that in the campaign, as you correctly noted.
I guess, sir, the comment would be that those folks waiting for mental health care, they'd like the money today. That being said, for Atlantic Canadians, of which I represent some of them, it appears in this from the PBO that there's really no benefit because we have a comprehensive program already. Is that correct, sir?
There are all sorts of programs in Canada. No program covers as much as this particular benefit. Now, for children under the age of 12, with all preventive, diagnostic, and curative services included, there's no other program in Canada that exists. Now, great news is that there is such a program. That's fine, because this is going to be complementary to what already exists.
So, sir, then it's clear that those provinces who have excellent programs now will be expected to continue those programs.
I think we're all in the same boat. We all want good health for our children, and the better we work together, the better it will be for our families and children.
Sir, am I correct in my assumption? Nova Scotia needs to continue its $11 million a year program for comprehensive dental care for children under 14.
I think we've seen over the last decades, and in fact over the last 155 years now, how Canada works as a team.
Sir, I think that's a simple question. Are they expected to continue their program?
Well, I think
for
we
$11
all expect provinces and territories to keep investing in the health care for their people, including dental health care. Dental health care is health care. Our mouth is part of our body. And it's not, it's a bit bizarre, and I understand why, to think that oral health is not part of health.
That's not an issue. For someone who spent $36 for a child under 2 to have a dental assessment and review, they are going to get $650 from this program. Is that true? Can you get less than $650, sir? Or do you spend $36 and get $650?
So what you do is you, A, spend on the dental care for your children. B, you need to have an income level which is below $90,000, and if you want to do
that part, sir.
And
do you get the money or not?
C, you cannot have access to private dental insurance, and therefore you are typically struggling in life. You have to look after your children. You don't have a very large income, and you have to choose between paying your rent, your groceries, or paying dental care for your children. And that's a very hard choice to make for many families.
Thank you. But that is your time. Dr. Hanley, please, for 5 minutes.
Thank you very much, and I'd like to add my thanks to the ministers and officials for being here. And Minister Duclos, you have certainly spoken well to the importance of oral health, and I salute this first foray into dental coverage for Canadians, coverage that we will expect to see eventually expand into full dental care for Canadians. So I can't emphasize enough how important an initiative that this is, and thank you for your work in this. So to follow on Dr. Ellis's point, I think we may not be in an acute dental crisis, but I think we all agree that we are in the midst of an affordability crisis. And I know in addition that access to dental care, including preventative care, is not equal around the country. In fact, I was at a national meeting of the Canadian dental hygienists in Whitehorse just a few weeks ago. Yes, we do have national meetings in Whitehorse. And we certainly heard loud and clear how important preventative care, dental therapy for children is to help set them up for lifelong health, good psychological health, good mental health, better attention and learning ability in class, less risk for chronic disease, and healthier teeth. So my question, do you think that that children who fall between the cracks currently of access to dental care through provincial and territorial programs may, during an affordability crisis, actually forego access to dental care? And therefore, is this a means to address not only affordability, but to enable access to dental care that may, for some children, not exist?
Yes, and I think that the phrase you point to at the end, Brendan MP Hanley, is one of the most important ones. Some of our children our children are not equal, and those with living in families with lower incomes are particularly struggling when they need to access dental care. Just to give you a quick figure, if we cut the population into three pieces and look at the third lowest income population with children, they have 2/3 of the cavities and emergency dental care needs of the population. So you see how unequally distributed the dental care conditions and therefore the dental care needs are across our children. So let's start by acknowledging that. Impacting those that live in families with lower incomes and those whose parents don't have access to private dental insurance. So we need to acknowledge that, and as we acknowledge that together, we can focus on how we can help those families look after their children. That's their objective. It's our objective, I believe, as policymakers as well.
Thank you. And to change tracks a little bit, again, for Minister Duclos, I take advantage of you being an economist, and maybe you can talk to the general principle of targeted versus broad measures to address affordability and to enable a break, as it were, for those who are most in need in the time when we do have a cost of living crisis and rising inflation.
Let me speak to what economists call utility. No, Jean-Denis and others wouldn't want to dig too deeply into this, but welfare or utility, well-being, to be properly defined, is as a function of many variables. And one of them is how much income you've got. But another one is your health. In French, we say que la santé ne s'achète pas. Et c'est vrai, la santé n'a pas de prix.
You can't buy good health. It has no price.
That as we reduce income poverty, which we have done very successfully through the Canada Child Benefit, we need to acknowledge that there are other conditions of our children that matter for their well-being. And health is one. And oral health is absolutely one of them. No, and when we invest in those, then we increase the utility function of the family. But more importantly, we increase the well-being of the whole family, including the children, because parents care about their children. When they struggle in asking themselves, where will I invest my rare dollars? No, do I invest them in buying clothing for school or buying nutritious food, which is very expensive? Or do I bring them to see a dentist? Now, unfortunately, too many of our lower-income families don't go to see a dentist because they believe that they don't have the means to do so, and that's very unfortunate in our collective and individual well-being functions.
Thank you, Minister. Next, back to Dr. Ellis for 5 minutes, please.
Well, thank you, Mr. Chair. I think very clearly we've obviously established there's no dental crisis here. We know there's a mental health crisis. I guess the question I would wonder is the minister has a long list of both government witnesses, private sector witnesses, other provincial government witnesses. And I guess my question is in this process, how many of those do you think we should be able to speak to here at the committee?
That's a great question, MP Ellis. I think you should ask yourself that question. It's your wonderful committee members. You have the ability and the power to make those decisions among yourselves.
Do you think it should be more than government witnesses?
I think this is a question you need to ask among yourselves. You have a lot of work, obviously, because health is a very busy committee, and you have all sorts of priorities. We just heard that we want to spend time on mental health, more time on mental health. There is the crisis in accessing family health teams. There are crises affecting our healthcare workers, long-term care, home care, palliative care. These are all important aspects of care and healthcare that you want to invest some of your time and resources in, I'm quite certain.
I think that's all those things are very, very important. And you use the word crisis many times, crisis. I think the Canadian Medical Association established there's a crisis, a catastrophe even, I think, sir, the words have been used by the president of the Canadian Medical Association, which is our Canadian healthcare system. And here we are spending money on this bill. What's the urgency, sir? I don't understand. I know you're going to tell me that oral care is healthcare. I get all that. Why do we need to rush this thing? $10 billion is a lot of money. And of course, sir, as you know, your government has already added more to the debt in 7 years than the previous 148 years of government of this great country. What's the rush to spend $10 billion? Why are we in a rush?
Well, I'm going to try not to be partisan, but I have listened to your questions, Stephen, and others in the House, especially from the conservative side, and you've pointed quite often to the affordability crisis that we are living in. And this is an important answer to that crisis. I'd find it very difficult to reconcile what I hear in the House about the need to support Canadians and low and average income Canadians, and what we are hearing from you now, which is that it's not a crisis, we can wait and wait for a long time before we help those families.
I guess, sir, I think it's important that we understand there's a guillotine motion with respect to this bill in the House, that we're not having, good debate with respecting $10 billion. Obviously, very clearly, sir, you don't understand the position that we have on this side of the House because and not to be disparaging towards you, but you're not articulating our position, nor would I expect you to do. It's certainly, your own partisan opinion, and I can understand that because it's hard for you to unravel that, I understand, as it would be for me to understand why you would want to spend $10 billion of Canadians' hard-earned money. And if you want to hand out checks for $650, then that's your prerogative. I don't have an issue with that. But the rush to get this bill through, when, as I said, we've clearly established here there's no dental care crisis, but we do know there's a mental health crisis out there. You're not addressing that at all, sir. Again, I'll go back to the $875 million, which should have been spent or at least budgeted by now, which is clearly not. The $4.5 billion in mental health transfers, which has not happened. We know that people are hurting out there, and that money which you already said you were going to spend, you haven't, and now suddenly, big surprise, it's necessary that we spend another $10 billion, which is absolutely mind-boggling to me, when clearly you said to yourself that in households, certain things need to be put on hold. Maybe
Point
this
of order,
is one
Mr.
of them.
Speaker.
Vancouver done?
Relevancy.
Wow. Relevancy.
Fairly broad latitude on relevancy. Dr. Ellis, you go right ahead. Come to your
sir.
point, but
Yep.
go ahead.
No, I think it's very important when we know there's a guillotine motion here to try and pass this legislation unbelievably quickly with respect to $10 billion give or take, with very little oversight, that this is mind-boggling to Canadians of how you continue to want to spend their money. I guess that's it. And I do want to go back to the fact that, again, Atlantic Canada, which already has a comprehensive program, really is getting no benefit from this program, as you've clearly pointed out, because there's not a copay in Nova Scotia that they could even apply to this program. And I guess then the question is why do you want to penalize Atlantic Canadians?
Well, maybe I should come back to your very early statement, MP Ellis, about the link between this package and inflation. I think it would be very unfair and perhaps even offensive to claim that investing in low-income Canadians is fueling inflation in Canada. Inflation is not driven by our support to low and average income families. Inflation is driven by the outcomes of the pandemic, the supply chain disruptions, by the war in the Ukraine, by energy crisis. Now, investing in low and middle income families is not driving inflation in Canada.
The minister's going on about me talking about inflation. I never even said the word inflation, so I'm not sure what the relevance of that is.
You took 2.5 minutes to pose your question, and he's going to take about another 30 seconds to answer it, and then we're going to move on. Go ahead, Minister.
Well, this $900 million investment to look after the dental care needs of our children, that's not driving inflation. That's not driving inflation in Canada, and that's not going to drive inflation in the rest of the world either. This is helping low and middle income Canadians. Inflation is driven by other factors than investments in our most disadvantaged families. That I think we need to resist spreading opinions on. I think we need to keep doing what we do all well, regardless of parties, which is to be mindful, as you do really well in the House, to be mindful of the cost of living crisis, repeating the need for the government to invest, to make the lives of lower income families more affordable. You do this really well in the House. We are reacting with this type of measures, and we hope everyone will support them.
Thank you, Minister. Mr. Van Koeverden, please, for 5 minutes.
Thank you, Mr. Chair. Minister Duclos, thank you for being here. A chief argument against C-31 here and in the House during the 11 hours that it was debated in the House has been that there are provincial government systems that are already in place. So I looked up some of them. I'm familiar with the Ontario Smiles program because I have constituents reaching out all the time who it fails and leaves needing dental care. In many cases, emergency dental care, which is not often covered, or the threshold for the eligibility on their income is exceeded. In Ontario, a family can earn no more than $27,000 with 2 children, and even with 8 kids, the income limit is $38,000, so it's extremely low. In Nova Scotia, which is far more comprehensive, it only includes 1 exam, 2 x-rays, and 1 cleaning, which I know that when I was a kid, I needed more than that at the dentist sometimes. So this will support many, many families in my riding, and certainly even some in provinces that already have a comprehensive program like Nova Scotia, which I'd note is not the only Atlantic province. It'll also have an impact on backlogs in hospital because, as you noted, there are, in many cases, young kids at the hospital with an abscess or in need of a root canal who then have to wait for a dentist to come to the hospital. There's also a lot of people in my riding who have changes in work, particularly recently, gig workers, self-employed Canadians who don't have insurance and earn less than $90,000 and will be eligible for this. So I'm certain that I'll be able to pass on. I'm actually surprised at the number of times as a local MP I've forwarded families with young kids to a dentist locally who will do it for free, despite the fact that the Ontario Smiles or Healthy Smiles program has failed them. I also looked at the Nova Scotia website, which said if any additional services are required, the dentist may charge for their own for any more at a private rate, which this program will account for. Any consideration for all those families? I just note that Conservatives seem to hate means-tested programming. Anytime there's a program that is sent out to people who really need it, families who don't have access, they either say that it's not doing enough or we're spending too much money. I actually find this, when I do the math, quite reasonable.
I think the fact that the member opposite is putting words into our mouths as conservatives and saying that we hate a specific type of program is absolutely lunacy and is going down a path that is not productive nor helpful. So I would ask him to keep on topic.
Thank you. I apologize for the
Debate, not a
lunacy.
point of order. Go ahead, Mr. Vancouver.
Thank you. Apologies for the lunacy. I just note that when we brought forward Canada Child Benefit, Conservatives suggested that people might spend that money on popcorn and beer.
Thanks.
Go ahead, Mr. Vancouver. You still have the floor.
Thank you, Mr. Chair. Any reflections on how this will have an impact on middle-class families who really need it in a time when there is an affordability crisis?
Thank you, Adam. And let us first acknowledge that there are programs and benefits financed and provided by provinces and territories, and that's all fine and great because we are a federation. We all need to play our role. This being said, we know that approximately 7 million Canadians don't go to see a dentist every year because they can't afford it. And many of these 7 million Canadians happen to be lower income Canadians, Canadians that don't have access to an insurance, a dental care, a private insurance. So 7 million Canadians, that's a lot of people. And as we said, that has all sorts of physical and mental health costs, both in the short term and certainly in the longer term for children. So as we acknowledge that, we also acknowledge that there are gaps in both eligibility and in the baskets of those dental care programs in Canada. 4% of total dental care expenses are covered by provinces and territories. But as I said, almost 30% of Canadians don't go and see a dentist, and out of all the total dental care expenditures, 40% of them are paid for directly by people out of their pockets. So 4% paid for by provinces and territories, 40% paid for by individuals. Many of them find it quite expensive, and many more, 7 million, don't even go and see a dentist because it's too expensive. So let's acknowledge that the existing system exists by definition, but there are severe gaps in both eligibility and in the coverage of the basket of dental care services.
Thank you, Mr. Chair. Now, again, many Conservatives have suggested that $500 isn't enough to make an impact. Ironically, at the same time, they're advocating that we should spend less money and lower payroll deductions, which would disproportionately benefit wealthier Canadians, as many as their suggestions would, and do nothing for lower-income Canadians who pay little or nothing to contribute to payroll deductions. So, Minister Hussein, like you, I come from a modest background financially, and I can imagine that $500 would have helped my mom a lot, particularly at a time like this. And for a single person who only earns $20,000 a year, I note that would represent 2.5% of their income. Can we reflect on the added benefit that an additional $500 will help Canadians do?
Thank you very much.
Briefly, please, Minister.
MP Vancouver, for that important question and your perspective on highlighting the importance of this support for Canadian renters. And again, the 500 one-time top up to the Canada housing benefits is on top of the already existing permanent, on average, $2,500 that is already going to vulnerable renters right across the country through the Canada Housing Benefit. And it's a program that is now real in all 10 provinces and 3 territories. We have agreements with all of those governments, and this is a cost-shared program. It is already delivering a lot of support to those Canadian renters. And this payment, which we expect to be launched by the end of the year, pending passage of this important legislation, I believe will deliver much-needed rental supports to Canadian families and individuals, and it'll make a difference. And we need to send that support as soon as possible, and I urge my colleagues to pass this piece of legislation.
Thank you, Minister. Monsieur Garon, pour 2 minutes et demie.
2.5 minutes, Mr. Gallant. Thank you, Chair. Mr. Duclos, I imagine you have full trust in the PBO, important institution, and he did table the report last Friday, that pointed out that Québécois will receive half of what other Canadian provinces will receive. Have you read his report, PBO's report? And as the spokesperson, if you will, the Minister for Quebec, Quebec is worth only half of what another Canadian would get through this program. Yes, I did read the report. And secondly, Health Canada is aligned with the PBO to understand these hypotheses he's put forward, that children under the age of 10 in Quebec have a system for dental care, but it's incomplete. All preventative measures are not covered by these programs. Most children that visit a dentist is for detartering or cleaning, and we are in close contact with the PBO. Thank you, Mr. Minister. So I imagine in your department you haven't established this without having done your calculations. Can you table here to the committee between now and the end of the week how you arrived at these amounts that are being devoted to these programs? Can you provide that information? Which we will do with great pleasure because you deserve it. You need the information, and most of this information is already public. For access to dental care in the country, including Quebec. Mr. Hussein, Quebecois have chosen their priorities, social, and they've decided to build a lot of social housing, affordable, low-cost housing. And according to the rules in Quebec, they shouldn't be spending more than 30% of their net income. They're currently excluded. We're talking about 96,000 vulnerable individuals, single-parent families for the most part. And your amendment would allow for these individuals to be re-included in the program if you abolished the 30% rule. As Minister of Health and Minister of Inclusion, what do you think of that amendment? Would you be prepared to step it up so that there be more equality for those who live in Quebec?
No, and I agree with you that many families and individuals in Quebec and right across Canada need this support now. Just want to remind you once again that we're already investing $454.3 million to provide 145,000 households in Quebec with rental supports through the Canada Housing Benefit Agreement that we've signed with Quebec. So that money is already flowing, and this is a $500 one-time top-up to that existing support. The 30% threshold is something that is recognized as a metric to make sure that all Canadians are eligible, no matter where they live, to have equitable access, and it is recognized as an indicator of whether an individual, has access to affordable housing or not. If they're spending 30% or more of their income on housing costs, then that's considered unaffordable.
Thank you, Minister. The last round of questions before we let you go will come from Ms. Kwan for 2.5 minutes.
Well, thank you. I actually am glad that I get this last 2.5 minutes. I just heard the Conservatives say that dental care is not in a crisis. Why do we need this in such a hurry? Well, I have to say that it's only been 60 years since Tommy Douglas introduced the universal health care, and part of that vision was always to include dental care. And so here we are 60 years later. I'm glad that we have this for Canadians as the first step. I note that the Conservatives voted against this last year, and they continue to be against it. I'm glad that the government had a change of heart and is now supporting this, so I very much appreciate it. So dental care is important, and it is needed, no question. So I do want to ask a question about housing, though, as well. The housing benefit is a one-time benefit, and yes, is on top of the existing benefit. Now, in light of the fact that inflation and cost is going up, and there's even projection that there might be a recession coming, would the Minister Hussein, be amenable to extending this program into next year, should the situation in terms of the pressures for Canadian families continue to persist?
Thank you very much. That's a really important question to highlight the challenges facing Canadian families. And I can tell you, as a government, we've had the backs of vulnerable Canadians throughout the pandemic and beyond, and even before that. This is support that is needed immediately. We need to get it out as soon as possible so it can get into Canadian families who need it now. And obviously, we'll continue to monitor the situation. We'll continue to be there for vulnerable Canadians, whether they need access to affordable dental care, but also whether they need access to affordable housing and rental supports through the Canada Housing Benefit. We'll continue to monitor the situation, but the focus right now is to get this support out as soon as possible.
Thank you, Minister. I hope that the government will bring forward a similar program next year. The dental care piece will continue next year for those others who are not qualified at this moment, but the housing piece will stop. So then I think we do need more than a one-time piece. The other thing is, which ties into, I think, the issue around mental health. Just because doing dental care does not necessarily mean to say that the government should not recognize the need for for mental health. Absolutely, the NDP calls for mental health support and investments to address that. And maybe the Minister Duclos can advise, can we ensure that the government will flow the money to address the mental health crisis?
Thank you, Ms. Kwan. And given that we don't have a lot of time, and given that we, for the first ever time in history, we have a Minister of Mental Health and Addictions, perhaps the committee, as a suggestion, might want to invite Minister Bennett. She would be most able and certainly very pleased to speak about the crisis and the action that we need to take and continue to take to address that crisis.
Thank you very much,
Appreciate that.
Minister.
Thank you very much, Minister.
It's now after 6 p.m. The motion that we adopted was to have the ministers come until 6 p.m. So thank you very much to each of you. We're going to continue on with your officials, but certainly appreciate you coming here.
Point of order, Mr. Chair.
Urgently, and yeah.
I appreciate the fact that our motion said that the ministers would stay till 6. Our meeting started late. You have been very loose with the time. I think that if the ministers were amenable, we only had 2 hours in total given for hearing from witnesses on this critically important bill. I would ask if the ministers would consider sticking around for a little bit of extra time. I'm not sure if the ministers are aware, but you guys are the only witnesses we are hearing from on this critically important bill. So I think that it is incumbent on you to stay so that we can continue asking important questions that Canadians have sent here to ask.
The meeting started about 4 minutes late, and the ministers have now overstayed the time allotted in the motion by 5 minutes. So I'm not sure that that's a valid point of order. I am, of course, in the committee's hands. The ministers have committed to be here with us until 6 p.m. and I guess I'm saying to them now that you're free to leave. We appreciate you being here, and we appreciate the patience with which you've handled all of the questions, and we look forward to continuing the meeting with your officials. Thank you. The meeting will suspend for a couple of minutes so the ministers can be on their way, and we'll be back in a couple of minutes. We're suspended. Okay, we're good. All right, call the meeting back to order. Thank our, oh. Thank you.
This is for.
All right, so I understand we have CRA officials with us in the room as well, so they're going to move up to the table. And the answer to your question, Ms. Goodridge, is no. We have a hard stop at 6:30 in order for the translation folks to get a bit of a break before we restart again at 7 o'clock. So there will be a hard stop at 6:30.
Relatively quickly. This is
The
an
meeting
absolute
is
abuse of committee.
back in session, and you have the floor for the next 5 minutes. Ms. Goodrich, go ahead.
Thank you, Mr. Chair. It's quite unfortunate that we don't even have our witnesses sitting at the table to be able to be here to respond to this. But at least we're continuing on, I guess. So I come from Alberta, and I've got a little kid. I'm not sure if you guys are possibly aware of that, but one of the questions that was raised to me by someone in my riding was, what would happen in a situation where, let's say you have a little guy like I have, who's like 14 months old, and he's got a full set of teeth, and so you decide that you're going to bring him for his very first dental check. And I looked it up on the Alberta Dental Fee Guide, and the Dental Fee Guide says that the charge is $77.18. So many dentists in Alberta charge well beyond the Dental Fee Guide, but let's say that they're probably sitting somewhere in and around $100 for a little guy to get his very first dental checkup, the first dental visit, and an orientation with the dentist. If a parent that was in low income went to apply for this benefit, would they be getting the full sum of $650 if there was nothing wrong? It was a very good, productive meeting. Would the parent just receive a flat payment of $650 even though their out-of-pocket cost was only $100?
Yes, the benefit is based, Mr. Chair, the benefit is based on application for, and if they meet the criteria, receipt of the full benefit amount of $650. And as Minister Duclos had noted, that is based on an assessment in consultation with experts on an examination of the average spending of Canadians in this age bracket in terms of dental expenditures.
Okay, so then this leads me to be quite concerned that, especially in this space where we're dealing with an inflationary crisis and parents are already having a hard time making the two ends meet, that they will apply for the least amount of dental possible for their child so that they can get this $650, so that they can use the extra money to be able to pay for groceries that month and pay for other things, and not perhaps give their child the full dental care that it might be found that they need, but instead do just the very bare minimum so that they can get access to this funding. Do you have any protections in place to prevent that from happening?
Among the criteria, the person needs to indicate the planned dental visit, either that has happened or is planned. There'll certainly be promotion and engagement with Canadians in terms of the importance in reaching the population of the dental care, working with dental providers as well, and associations on the importance of these early investments. And indeed, as experience for many of us have indicated with our children or ourselves, those initial visits and checkups can identify cavities and other challenges that this program will be able to support.
No, and I think that early intervention in dental is critically important. My husband and I were chatting about the fact that we should be bringing our little guy to get his teeth checked because he now has 8 teeth, and want to make sure that we're taking care of his oral health. My fear becomes that they will take them for a visit. The dentist will identify that there are cavities and money well beyond the $650, and the parents will opt to not spend any further money and take the money that has been paid to them through this program to help cover the shortfalls that exist elsewhere in their budget.
Mr. Chair, as noted, I think the overall focus of this benefit, it's an interim measure to support families of low and average income to access dental benefits. It does consider those situations where expenditures could go beyond $650 in terms of accessing in a year the total $1,300 of benefit over the course of 2 years. But I think the fundamental point is that there are Canadians in need who aren't accessing services now, and this will enable them to access those dental services.
Thank you. And I just want to point out for the committee's knowledge, contrary to what my colleague from Milton suggested, it was the phrase beer and popcorn actually comes from 2005 when there was a senior Liberal strategist and advisor, Scott Reed. He was a senior strategist to Paul Martin, who suggested that parents would spend their child benefit dollars that were being proposed by the Conservatives at the time on beer and popcorn rather than on childcare. So it's actually a statement that came from Liberals, not Conservatives. And I can understand the confusion because Scott Reed is actually a fantastic Conservative member of Parliament, but there is also a Liberal strategist by the name of Scott Reed. So thank you.
Thank you. Thank you, Ms. Goodrich. Dr. Pawlowski for 5 minutes, please.
It's me. I didn't know it was me. So the question was, we've heard repeatedly, what is the hurry? So I want to ask the officials about it. Presumably the hurry is the fact that we realize that there are a lot of families who are struggling to get by. And the dental benefit is $650 per year. The end of the year is January. The first reading of this bill was in September 20th. Before this actually becomes law and you get the $650 into people's pockets, and it's a spending bill, so doesn't it have to first go to the Treasury Board? Doesn't it have to go to the Senate? And is that not the reason why we were trying to get this done as soon as possible?
Mr. Chair, I think Minister Duclos previously spoke to the importance of this in supporting the affordability challenges low and lower income Canadians are facing. In terms of the process of moving the bill forward, I'll turn to my colleague Lynn Thompson to speak to it.
So we are hoping to get royal assent fairly quickly and bearing amendments or limited amendments because that could have an impact on CRA systems. We are hoping to be able to launch on December 1st. The way that the bill has been structured, given that it is not a full year in order for parents to get access to the benefit and be able then to go visit a dentist and bring their child for their care, they could, the bill has been tabled, they could go as of now, so we've said as of October to at least allow a little bit of more, that build-up period, up until June 30th to go see that oral health practitioner.
Sorry, I'm just a little unclear about the timeline then. So people would start being able to access this benefit when? The $650 before the end of the year?
Once we've gotten royal assent, and then CRA will do the changes it needs to the systems to be able to launch. And as soon as it's launched on day one, parents that fit the eligibility criteria that we've talked about can apply either through my account or by calling CRA.
The second question on attestation, what's required in order to access the benefit. I know the wording is pretty loose there. All that's required is the intent to have dental treatment. Now, I know the opposition just thinks our government is perhaps stupid, but I don't think that is true. I think there was some thinking that went into that, and the fact that poor families and poor families with kids are struggling to get by. There's a lot of costs in life. Dental is certainly one of them, but you have to buy your kids shoes, you have to buy them food, you have to pay for their minor league hockey. These are all costs for families, and perhaps we did that on purpose, made it fairly vague, and that as many people as possible could apply this benefit, and hopefully people will use it for their children's oral health, but it can be used, generally speaking, for people of low income with families who are struggling to get by and who need the money as soon as possible. So I'm suggesting, is that why the rather loose wording and the requirement that perhaps you don't actually get your whole $650 worth?
Mr. Chair, I think the government's intent with this portion of the bill is clear, to support access for low and lower income Canadians for dental services for their children. It is based on an application, and that application has a number of criteria as outlined in the bill, including the fact that they have either received dental services and or plan to access the services, and they will be attesting to that as part of the application to receive the benefit, which we believe, based on analysis and work with experts and survey data in terms of average expenditures by Canadians on dental care, will address the majority of the need.
Because we know there's a lot of challenges for parents in the income brackets that this bill is targeting to go to the dentist upfront. So this is a way to get money to then allow them to visit the dentist instead of being a reimbursement necessarily. So it is about providing that, and it's not necessarily, you have to keep the receipts. CRA may then do, as part of compliance, outreach to the various families, and then you do have to produce receipts. So there are different thresholds, though, in terms of that attestation. You also have to provide the name of your employer to make sure that, again, from a compliance perspective, we can ensure about access to private insurance. So there are different layers there in terms of the attestation base.
Thank you, Dr. Pawlowski, Ms. Thompson. Mr. Doherty, please, for 5 minutes.
How are, and I really don't know who I'm directing this at, but perhaps the most knowledgeable witness will be able to chime in. How are dental fees set in Canada?
Mr. Chair, dental fees are set by provincial dental associations. They establish their fee guides for the range of different services they offer.
So would it be fair to say that the government is stepping into providing a relief or a benefit to Canadians that they will want at some point to ensure that that $650 or whatever that benefit is going to actually, that dental care is going to be affordable?
We have, as in establishing the benefit level, as Minister Duclos indicated, looked at typical basket services from preventative to treatment to curative, and utilized information based on fee guides and understanding of their evolution over time.
With all due respect, is there anything stopping the dental associations from seeing that this benefit is now out there, from raising their fees and making it unaffordable for these Canadians that are receiving this benefit?
Mr. Chair, I would just observe that the annual work on fee setting through the dental associations happens in a broader context with their support for Canadians who are supported through programs of their employers, Canadians who pay out of pocket, the work with provinces, and then this benefit to help address the gap faced by those people.
Will the government be overseeing that at one point, stepping in and doing their due diligence to make sure that $650 or whatever that benefit in the future is set at, that it's still going to have a measurable impact and be affordable, and Canadians that are marginalized that require dental benefits are going to be able to afford this?
Mr. Chair, as the bill envisages, it's a interim dental benefit over a 2-year period as the government develops its longer-term program. In developing the longer-term program, the government will be considering a whole range of factors, including working with all stakeholders, provinces and territories, dental associations, and looking at those broader issues.
I guess an easy question. Will there be checks and balances? Will somebody be checking from the government to ensure that the independent dental associations are not going to take full advantage of the situation and raise the fee guides?
Mr. Chair, the government will certainly continue our engagement with those dental associations, as with a broad range of dental health, oral health stakeholders. Again, those fee guides and the dental associations work in the context of support for employer-based plans, people paying out of pocket, provincial services. So there's a broader consideration than just this.
I appreciate that. Thank you. Now, just going back to perhaps the previous questioning, this is going to be solely based on an honor system. So Canadians will apply for it. If they meet the criteria, they'll receive it. But there's no guarantee that they'll use that towards dental benefits. They could, as Mr. Pavlos, or Paul, I'm going to get your name right at one point, Marcus, his comments that they could spend it on hockey gear or sporting equipment instead. Is that correct?
When they're applying for the benefit, they need to attest. They need to attest that they will be using the funds to bring their child to see an oral health practitioner. And I use that term because there could be a dentist, oral hygienist. There are different practitioners there, and sorry, okay.
Again, it's the honor system.
And there's a bit of teeth in the bill as well, and there is compliance. And if people are found to have provided misinformation, there are consequences as outlined.
Okay, I appreciate that. If Bill C-31 is adopted, applicants have a 90-day window after the RHBA come into force to which to apply for the rental housing benefit. The bill also provides additional details on how the rental housing benefit would be administered. But if they miss that 90-day window, what provisions are in place for Canadians that are requiring this relief?
Thank you, Mr. Chair, for this question. The 90-day window is definitely part of the bill, and we are working with Revenue Canada to have some very strong communication plans to help Canadians get their income tax filing, 2021 filing, in time.
Because it's based off of the previous year's income, correct?
The 2021 income. As fast as they can, making sure that they have access to my CRA account, because this is the platform that will get more efficient dollars to Canadian as fast as we can. And so there is a lot of communication strategy in place to get to Canadians, including being at the local with communities and working with them.
Thank you, Mr. Doherty. We have about 3 minutes left before 6:30. Ms. Sidhu, you have the floor for that time. Go ahead.
Thank you, Mr. Chair. My question is, would legal guardians be eligible to apply for the Canada Dental Benefit for children under 12 years of age who are in their care? Yes. Thank you. And any other, you want to give rationale to the Canadians, like when it's going to be started, and then who can be eligible?
Sorry, I didn't hear your last.
Who can be eligible? Can you give that how many people are getting the benefits from? How many kids are getting benefit from?
So we've estimated 500 children. 500,000 children would be receiving this benefit.
Thank you very much, Ms. Sidhu. Thank you to all of our officials. I understand that you're going to be back with us here in a half an hour as we begin clause by clause. So thank you for taking the questions, the substantive questions, and we look forward to having you back here after we get a little pause. So with that, is it the will of the committee to adjourn the meeting?